The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. February is American Heart Month, which always includes the Go Red for Women campaign, which is why you'll see a lot of the color tonight. Heart disease is the #1 cause of death in the U.S., killing more people than all forms of cancer combined. Cardiovascular disease kills one person every 33 seconds in the U.S. Tonight, we'll talk with a cardiologist about what you can do now to reduce your risk for heart disease, and a young heart attack survivor, along with a representative of the American Heart Association. Tonight, we're putting heart health in focus. Joining us is Dr. Joy Cotton. She's a cardiologist with Penn State Health. Thanks so much for being here.
I'm happy to be here.
Dr. Cotton, what is cardiovascular disease?
That's an umbrella term to cover everything concerning blood pressure or anything to do with the heart and the vessel system, the vascular system.
So it can exhibit itself in many different ways.
Yes, simply as high blood pressure, or then more extensively if you're having particular problems with your heart.
So what causes, say, a heart attack?
When one of the vessels that supplies the blood to your heart is narrowed progressively to a critical point or suddenly closed with a blood clot, and the blood flow is instantly stopped to the heart muscle beyond it, which then creates a heart attack.
Obviously, you can die from that.
You can die suddenly. You can get to the hospital quickly enough for us to help you get through it and not die suddenly.
So does everyone who has cardiovascular disease end up having a heart attack, or not so much?
No, and we have many treatments and ways to mitigate what can happen, and we have a lot of good therapies to reduce your chance of having a bad outcome.
All right, well, we'll talk more about those later, but what about sudden cardiac arrest? How does that differ from a heart attack?
Well, sudden cardiac arrest happens or can happen for a number of different reasons. It can be just an abnormal rhythm that can suddenly take your life, or a rhythm that develops in the throes of an acute heart attack, and it suddenly doesn't pump sufficient blood, and you suddenly pass. So that's the result of a number of different possibilities.
And so that's not necessarily related to cardiovascular disease? So
yes, it is. It is. But what I'm saying is there are a number of different things that can cause the sudden death.
We often hear about, you mentioned arrhythmia, or I guess AFib. Explain that and what kind of risk that is.
Right. So atrial fibrillation in particular increases with age. Sometimes just the aging system, the aging heart, the aging neurologic system of the heart, and you develop atrial fibrillation. It can be from a number of other reasons, like poor heart valves or high thyroid, low thyroid can precipitate this atrial fibrillation, which is an irregular rhythm from the top of your heart. The heart still beats, but it beats irregularly and sometimes more inefficiently.
And that puts you at risk, or greater risk, for stroke?
Yes, because when the heart's not beating regularly, you can develop a clot within the heart that can then be pumped out and end up in your brain, giving you a stroke, or anywhere else. But the fear is a stroke.
Yeah. What are some of the risks for cardiovascular disease?
The most common ones are family history that we can't avoid. If we have siblings or parents with heart problems at a young age, high blood pressure, high cholesterol, diabetes, smoking, poor habits otherwise, lack of exercise. Once you start exercising, your risk drops. So, but the biggest, most worrisome things are family history, high blood pressure, high cholesterol, diabetes, smoking. And those are the things we try to target because we know we have benefit when we target those.
Obviously, some of them you can't control, such as aging or your family history.
Aging, family history, no, you cannot control. So obviously we can't do anything about those, but the other things we can. And you work with your physician, your provider, to treat those things that we can, and the rest is on us. It's under our control to eat right and to exercise and stop smoking if we smoke.
All right, well, let's talk more about that, how you can control these things and how to have a better lifestyle, and some of the new treatments on the horizon.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Dr. Joy Cotton. She's a cardiologist with Penn State Health. Again,
Yes.
thanks for being here. How does this disease affect women differently from men?
So it's just as common in women than men, first of all. And secondly, both men and women most typically get the typical symptoms if they have heart problems of this big pressure burning in their chest with activity that goes away with rest. That's common. But more commonly in women than men, we get more what we call atypical symptoms of just not feeling right, or flip-flops in your chest, or exceedingly tired that's out of the ordinary for you with normal activities. And
Kind of
those-
vague symptoms.
Yes, it can be vague and nondescript. And dizziness with flip-flops is not uncommon. And then if you put that in the setting of increased risk factors, then you really have to think about it. Do I have a problem with my heart? And you really should seek attention. So it's not to be ignored. And the other thing that I find significant, if not interesting, in clinic is that we women, we tend to make sure that our family members get taken care of and get to their appointments and take their medications and do what they need to do to protect themselves. But let's not forget about us, to push ourselves and do our self-evaluation. Do we need to be seen concerning these issues? And then get to our appointments and take care of what we need to take care of as well, so that we can continue to push our family members to get what they need.
Yeah, everybody else, right?
Yeah.
I imagine over the course of time, there's a lot of new treatments and good treatments for this disease.
Yes, we have a lot of medications, old that we've been using for a long time, plus newer ones. So depending on how each individual responds, we can tailor that therapy depending on how they respond, what they react to or don't react to, and what they need. And so there are 8 or 10 or 12 different therapies for cholesterol, for example. There are a number of different categories of drugs for blood pressure. And then the technology is advanced that we can do more procedures that help us feel better and live longer, all of those things together. So it's been very progressive over the last 5 to 10 years even.
Yeah, a
for
lot
what we
of
can do.
like not so invasive procedures.
Yes, procedures for valve abnormalities have progressed dramatically so that we can do a lot of those procedures through the skin without opening, the classic opening the chest. We need that sometimes, but we can do a lot more than we could 10 years ago. Has progressed dramatically.
But yet it is still the #1 killer in this country.
Yes, it's very, very common. And if you don't have it, I'm sure that you know somebody that has it. So I can't emphasize enough, it's exceedingly important to have a little self-introspection and see if you have the risk factors and talk to your doctor about it.
And you might have it and not know it.
That's true. There are a lot of silent problems. And blood pressure, for example, you don't feel it for the most part unless it's really severe, but you can have it for a number of years and not know it. That's why we check blood pressure every time any office you check the blood pressure, because most people develop high blood pressure with age, so we check it every time. And it's
But I read that it's important how you check blood pressure.
You have to be sitting appropriately, your arm at heart height, doing nothing for 15 minutes. I'm constantly telling people you have to rest to get a baseline blood pressure. And do nothing. That's the hardest part because we're so busy getting everybody what they need. So you sit for 15 minutes doing nothing, rest your arm, heart height, and take your blood pressure.
That's funny because I went to the doctor and she did say, the person taking my blood pressure said, "Oh, I did that too quickly."
You have to let people rest.
Yeah, so what are you optimistic about in terms of heart health?
That the treatments are very effective and that reducing your risk profile dramatically reduces your risk down the road of developing a heart attack, even by 50% for each thing that we do. So that's a dramatic improvement. And medications keep getting better and the treatments keep progressing. So there are a lot of things that we can do to help get to feel better and prolong life.
Yeah, that's the optimum thing. Thank you so much. We appreciate you being here.
Glad to be here.
And coming up, we'll hear from the American Heart Association when we continue.
This is WGAL 8 in Focus, coverage you can count on.
We're joined now by Larissa Bedrick. She is with the American Heart Association, and we thank you so much for being here.
Thanks for having me.
We keep saying year after year that heart disease is the #1 killer of men and women. Are we making headway?
We are making headway. This year, actually, the American Heart Association is celebrating its 100th anniversary. During that entire 100 years, heart disease has been the #1 killer of all Americans. But we've definitely made headway in raising awareness and reducing the impact of cardiovascular disease. Currently, we estimate that still, though, around 50% of people are not aware that it's their #1 killer. So we still have a lot of work to do, but we have made tremendous progress in reducing deaths due to cardiovascular disease. In fact, we estimate that there's been about a 60% reduction in cardiovascular disease death rates during our past 100 years, which is tremendous progress.
Yeah, because there's so many new treatments and even surgeries out there.
Absolutely, yes. And one of the things that the American Heart Association has done over that 100 years is funding over $5.7 billion worth of research, of course, which has led to new innovative treatments, has led to a greater understanding of what causes cardiovascular disease and how to prevent it.
We hear about lifestyle a lot. I think we're all under a lot of stress, and maybe even more so in the last few years. How do you think that impacts possibly heart disease itself or our mental health, which then may impact how you conduct your life?
Absolutely, yes. Stress definitely has an impact on your heart health. And, you know, we've noticed over the past few years, ever since the COVID-19 pandemic, that a lot of people, and women in particular, have been reporting increased stress levels, feeling increasingly overwhelmed, diagnosed with depression, all of which can increase your risk for heart disease. Also, really, it is significantly more difficult to maintain all of those other healthy habits we always talk about, like eating healthy, getting more exercise, getting adequate sleep, and maintaining your weight. All of those become much more difficult if your mental health is suffering.
And this is a disease that affects men and women, as I said.
Absolutely, yes, both men and women. This year we're also celebrating the 20th anniversary of our Go Red for Women movement, which of course focuses on raising that awareness among women that heart disease is their #1 killer.
Yeah, and often the symptoms can be different in men and women.
That's correct. The #1 symptom for both men and women of a heart attack is chest pain. We often think of that Hollywood heart attack of clutching your chest and falling to the ground, which in most cases probably isn't accurate. The chest pain is the most common, but women in particular are more likely to experience pain in other areas of their upper body, like their jaw or their arm or their back. Also sudden lightheadedness, sudden dizziness, sudden nausea, sort of breaking out in a cold sweat. All of those can be signs of a heart attack.
Wow, lots of different symptoms. What about CPR? Is that still an important thing for people to know? I know over the years we've sort of changed the way we approach it, but what about that?
It is very important, and in fact, that's a huge focus for us this year. We've actually set a really ambitious goal of doubling cardiac arrest survival by the year 2030. So we've started an initiative called Nation of Lifesavers, where we really want more people to learn how to save a life using hands-only CPR. And in fact, as women are concerned, they're a lot less likely to receive CPR in an emergency than men, and are more likely to die of sudden cardiac arrest outside of a hospital. And in fact, if someone doesn't receive CPR right away, the survival rate is only around 10%.
Wow,
so,
why do women receive it less, do you think?
You know, we think there might be a little bit of hesitation responding, confusion about hand placement or concerns about inappropriate touching, but we want everybody to be able to feel comfortable doing it, and unfortunately only around, actually 70% of people say that they would be uncomfortable responding to perform CPR in an emergency. And it's very easy to learn, especially hands-only CPR.
And many places you can learn it, can't you?
Absolutely. In fact, we have a very quick tutorial online where you can learn hands-only CPR, which is just 2 steps.
And still the singing to
the chest compressions, and yes, you can
songs.
sing to Staying Alive or Baby Shark, if for some of our younger viewers here.
But really important that people know it, yeah?
Absolutely. It can double or triple someone's chance of surviving a sudden cardiac arrest.
Or also I know in our building here, we have, the machine that can help people,
Yes, the AED.
Right.
That's also very easy to use. And in fact, you don't really need training to use it because all you have to do is turn it on and it tells you what to do. They are very automated.
Yeah, and that really works.
It absolutely is important.
All right, well, Larissa is going to stay with us, and we're going to be joined by a young woman because heart disease can affect younger people, so stay with us.
This is WGAL 8 in Focus, coverage you can count on.
And we're joined now by Sierra Zeger, and she joins Larissa Bedrick as well from the Heart Association. And Sierra has quite a story to tell what happened to you when you were just 14. Tell me about that.
Yeah. Well, thank you for having me, number one. When I was 14 years old, I woke up after a school dance and realized I could not put my shirt on. And I started walking down the hallway to let my mom know that I could not put my shirt on, and I couldn't figure out why. And I blacked out halfway through walking down the hallway.
Wow.
Yes. So I found myself lying on the floor, and I knew my mom was downstairs, and I tried to call out for her, and I realized I couldn't muster up enough breath to even say mom. And I somehow found a little bit of air to say mom, and she somehow heard me from across the house downstairs.
Wow.
Yeah, mother ears.
I was going to say, mothers do that, right?
Yeah, she definitely helped save my life.
So you obviously went to the hospital. What was the
Yes.
diagnosis?
So after a few hours of testing, they diagnosed me with teenage anxiety. Yes.
Wow.
Yeah.
Obviously it
It
wasn't
was-
that, right?
Yes, and it was extremely hard to hear because I knew that pain wasn't teenage anxiety, but I trusted the medical professionals that they knew what they were doing and what they were diagnosing. But they did refer me to another hospital. They wouldn't let me go home still after that.
And then what was the diagnosis finally?
So hours and hours later, they didn't diagnose me quite yet. They said that they found a blockage somewhere in my body. My levels that were pulled from my first hospital came back and showed that there was a blockage. So they went
In your heart?
Yes. Well, the troponin levels. So that came back, and they said you need to go into emergency surgery. And I had no idea going into the surgery what was going on. All I knew is I was getting cotton candy anesthesia and a warm bed, and I didn't know anything until I woke up.
So you had a heart attack, and you
Yes.
also were diagnosed with a hole in your heart, correct?
Yes. So I was diagnosed with a congenital heart defect or a hole in your heart, which is not as uncommon as people may think. And I had a blood clotting disorder called elevated lipoprotein A, which is being highly researched right now by the American Heart Association. And that blood clotting factor created a blood clot, and that blood clot traveled through that hole in my heart and got lodged in my coronary artery,
Wow.
which caused that blockage.
Larissa, obviously 14 is very young, but heart attacks and cardiovascular disease can happen at young ages, can it?
Absolutely, and we're actually seeing that on the rise among younger women. So while, women, Sierra's age probably aren't thinking much about heart disease or their heart health, but we are seeing that sort of increase in heart disease diagnosis among younger women. And, especially, as women get a little bit older, and I think as, health factors change with them, all throughout stages of their life, it's something that they need to take seriously.
So it's never too young to start knowing what your blood pressure is or your other levels or numbers?
Not at all, especially, younger women may think they're doing everything right. They may think they're still active and eating healthy, but sometimes you might be surprised. Those numbers might tell a different story.
Absolutely. So Sierra, how are you doing now? This is almost 10 years later.
Yes, I actually just celebrated my 10-year anniversary for my heart attack. And to me, it is a celebration of life because I'm here today and I'm able to spread awareness for the American Heart Association and heart disease. I'm doing great. I work out every other day and building that endurance back up. I had open heart surgery 3 years ago, so trying to build up from that. But besides that, I'm doing great and living a pretty normal lifestyle.
But you've been through a lot. Has that affected your mental health?
Yes. I don't think there is enough focus on mental health in the cardiovascular world. Going through such a traumatic thing in your life, it needs a lot of support. You need a lot of support after something like that. And there are some things out there available, but I believe that people aren't having the right access to them.
Or maybe not coming
Yes.
forward and saying, I need some
Yes.
help. I know that that is another focus of the American Heart Association,
Yes.
isn't it?
Yes, absolutely. Yes, mental health, I think, is something that we are absolutely trying to pay more
Yes.
attention to because they are really inextricably linked.
And certainly after you go through something like that or a heart attack, there can be depression and other mental health issues after the fact.
Yeah, that's absolutely, a known fact that, it increases risk for depression after a heart attack or stroke.
Wow. I know you said, as a scientist. Did you go into
Yes.
that field because you had some experience with the medical field?
Yeah. I was very interested in the medical field after going through such an event in my life, and I'm able to help on the back end of that as a scientist. And, I know I'm saving people's lives. Little do they know. I'm not the distributor, but I am helping save lives. So,
Wow.
yeah.
Well, what a great spokesperson for the, support for the American Heart Association to have such a lovely young woman, isn't it?
Yes, and in fact, her story was so incredible that she was selected last year to be a national spokesperson for the Go Red for Women movement and had a lot of really great opportunities to share her story with a large audience last year.
Oh, that's wonderful. Well, we're so happy that you're healthy and happy and doing well.
Yes, thank you. Thank you. I appreciate it.
Yeah. Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus, right after NBC Nightly News. And you can watch each episode of In Focus, plus WGAL's latest newscasts, original programming, and more. Just download the Very Local app and stream for free on Roku and Amazon Fire TV.